So you walked out of your doctor's office with a clean bill of health. Your labs were normal, your thyroid is fine, your blood pressure is fine, but you are not fine. You can't remember your words. You're exhausted before noon. You feel like you're losing your mind, and nobody seems to take it seriously. Does that sound familiar? Well, stay with me because what I'm about to share might be the missing piece you've been looking for. Hi, I'm Dr. Lola Ashaye. I'm a board-certified family medicine physician and founder of InTouch Primary Care in Sugar Land, Texas. And I specialize in women's primary, preventative, and perimenopause and menopause care. And I help women finally get real answers about what's happening in their bodies. So let's get into it. But first, let's call her Sandra. She's 44. She's a school principal. She holds everything together for everyone. But lately, she's been terrified. She actually forgot the name of a student she had known for 3 years. She walks into rooms and doesn't know why she's there anymore. She went to her primary care doctor. She had lab work done. She was told everything looks great. She felt feeling more confused and honestly more scared. She was thinking maybe she was stressed out, but then she told herself, this isn't stress. Well, Sandra was in perimenopause and nobody told her. The issue is the standard labs, the thyroid, the CBC, the CMP, the Comprehensive Metabolic Panel, they are not designed to detect perimenopausal hormone shifts. The reason is estrogen levels fluctuate wildly and it doesn't show up as abnormal in routine panels. So estrogen is the brain's most important neuroprotective hormone. And when it starts to fluctuate, which happens during perimenopause, it directly affects memory, focus, verbal recall, and energy. And there was a study just this year in 2026 by Cambridge. It studied 125,000 women men that were confirmed to be in menopause, and it showed measurable changes in their brain structure. The gray matter in memory and emotional regulation areas literally shifted. So, before I keep going, if anything I've shared so far has resonated with you, please take a second to like this video, share it with a woman in your life who needs this, a friend, a sister, a colleague, your mom. You might not realize it, but that one share could be the thing that finally gets the answers she's been looking for. It costs you nothing. It could change everything for someone else. So, okay, let's keep going. So, let's talk about brain fog. So, brain fog, word finding difficulty, and fatigue are actually neurological symptoms. They are not just stress. They're not just in your head. Um, they're there, but they're real. Okay. So perimenopause can begin in the late 30s to mid 40s, years before your changes. So women routinely miss this because they feel like they're too young by, standards of perimenopause and menopause. However, because it could be 2 to 10 years before you actually go into menopause, it can be easily missed. So the right evaluation includes hormone-aware clinical assessment, symptom history, and sometimes targeted hormone panels, not just a routine wellness check. So maybe you've heard, my doctor said my hormones are fine. Well, the standard labs check in for menopause don't really address perimenopause. There's a difference because during perimenopause, you're still in transition. So you still have hormones, but they're fluctuating. During menopause, your hormone levels are much lower. During perimenopause, your hormone levels fluctuate. They go high sometimes, they're low sometimes. So if you check it on any given day, it might look normal. Sometimes people think, oh, maybe I'm just anxious. Well, anxiety and cognitive symptoms in midlife women are frequently hormone driven. So treating only the anxiety without addressing hormones sometimes does not provide complete relief. Sometimes people feel like, yeah, I'm too young, I'm still in my late 30s. Well, the average age of perimenopause is 40 to 44. So, depending on when you're having symptoms, you may not be too young. And some people, their mother never talked about this. Well, unfortunately, back in the day, a lot of women didn't talk about it. But in this generation, more women are talking about it, and there is help, there is relief for it too. So if you've been feeling foggy, forgetful, or just off, and your labs keep coming back normal, I want to talk to you. You can book a consult with us. Let's do a real evaluation, not a checkbox, a conversation, a partnership. And the link is in the description. So imagine if you walked into your next appointment and your doctor looked at your whole picture, your symptoms, your hormones, your brain, your quality of life, and said, I hear you. Let's figure this out. Imagine waking up feeling, having clarity, feeling like yourself again. That's not a dream, it's possible. And that's what proactive care looks like. And that's what you deserve. I hope that helps.